Hello, this is Dr. Mark Lebwohl. I'm the Waldman Chair of Dermatology at the Icahn School of Medicine at Mount Sinai in New York. I will be discussing psychiatric adverse events in Brodalumab psoriasis studies. I was the principal investigator, presented the results at the American Academy of Dermatology annual meeting in Orlando from March 3rd to March 7th, 2017. To summarize the results of the study, in patients with moderate to severe plaque psoriasis, anxiety and depression scores were reduced from baseline in patients treated with oral Brodalumab. Patient satisfaction and quality of life were higher with Brodalumab compared with placebo. Suicidal ideation and behavior were similar over 52 weeks in patients treated with Brodalumab compared with ustekinumab. The rate did not increase with long-term Brodalumab treatment. This study is important because it provides reassurance that Brodalumab does not lead to a higher rate of psychiatric outcomes, including depression and suicidal ideation and behavior. This study was designed as follows. It actually is a report that was a retrospective analysis of 1 phase 2 and 3 phase 3 clinical trials involving Brodalumab in patients with moderate to severe plaque psoriasis. Exclusion criteria for psychiatric or substance abuse disorders. Brodalumab was given as 140 milligrams or 210 milligrams every 2 weeks. The majority of patients were treated with the 210 milligram dose by the end of the 52-week controlled period in the phase 3 studies. The HADS, or Hospital Anxiety and Depression Scale, was utilized in one of the phase 3 studies. All 3 phase 3 studies utilized the DLQI, the Dermatology Life Quality Index, to assess the socio-psychological impact of this skin disease on patients' lives. Psychiatric events were pooled for all trials and were summarized as follow-up time-adjusted event rate. And the key findings of the study were as follows. In the 4 studies, 3,066 patients receiving Brodalumab, 613 receiving ustekinumab, 879 receiving placebo were reported. In the Imagine-1 phase 3 study, approximately 75% of patients with either dose of Brodalumab experienced improvement in depression compared with approximately 45% of placebo patients. Improvement of depressive symptoms to normal was observed in approximately 40% with either dose of Brodalumab. Symptoms worsened in 5% of Brodalumab patients and 10% of placebo patients. Approximately 65% of patients in both Brodalumab groups experienced improvement of depressive symptoms with improvement to normal in 30 to 35%. In the phase 3 studies, patient satisfaction with treatment was significantly better with both doses of Brodalumab compared with placebo. Patient satisfaction was similar for Brodalumab 140 milligrams and ustekinumab. In the 4 studies, depression both occurred in less than 1% of patients treated with Brodalumab, ustekinumab, or placebo. The integrated analysis of follow-up time-adjusted patient incidence ratios of suicidal ideation and behavior were 0.20 for Brodalumab and 0.40 for ustekinumab in the 52-week pooled data. 0.37 for Brodalumab for the long-term data that included an uncontrolled open-label extension phase. The rates were greater in patients with a history of depression or a history of suicidality compared to those without those histories. 2 suicide attempts in 1 patient treated with Brodalumab were reported during the 12-week induction phase. Brodalumab, in its approved label, received a black box warning for suicides that occurred in the course of the phase 3 trials. In this study, the authors looked at the hospital anxiety and depression scale and reported a reduction in the HAD scale and an improvement in the Dermatology Life Quality Index. The suicidal ideation and behavior reported in the trial was similar in Brodalumab-treated patients compared to ustekinumab-treated patients. Based on the results in the study, there was no causal role suggested for Brodalumab and depression or suicide.